Hello everyone, I'm Dr. Mahalakshmi, your faculty for Forensic Medicine and Toxicology. A very good and warm greetings to you all. And whatever situation that you are in right now, just know this is not going to determine where you are going to go. It is merely a start. You can always change where you want to go and you can always achieve what you want if you keep your mind at it. So with this thought, we will start the class today. So today in this class, we are going to see a bunch of medical clinical scenario questions which is mostly like concerning the medico legal aspect and the clinical toxicology aspect, and also a few important parts in the forensic. So this will be really helpful for your NEET exam and also the INI exams, because with this new pattern of questions nowadays they are not asking the simple one liners or the theory parts from forensic and all the non-clinicals. So they are mostly clinically oriented questions these days. And in forensic especially, they are concerning more about the medico-legal aspect, especially these medical ethic aspect. So with this medical ethics, we are going to start today, and this is a very high yield topic. So the first question: a 55-year-old male present to emergency department with severe chest pain and shortness of breath. So the attending physician, after a brief examination, diagnoses him with indigestion and prescribe antacids without performing any further test. So later the patient suffers a myocardial infarction, and now the patient decides to pursue legal action for professional negligence against the physician. Which of the following elements must be proven to establish negligence? So the question is simple. They are asking what point need to be proven to say that this is a case of professional negligence. Now all these big thing, this is how they are asking now. So if you think a bit, if you ponder a bit on the question, you will easily understand what they are trying to say. So this part is the only question part. So now they have given the options. The physician acted with low standard of care compared to other physicians. The patient must demonstrate that physician's actions were deliberate. The physician failed to provide care that met the accepted standard, leading to harm. The patient must have signed a consent form prior to treatment. So now, like when you see all the options here, now you have to know one concept. So what is professional negligence and why do we call something as a professional negligence? If you know this concept, you can easily answer this question. Now, what is professional negligence? So professional negligence is what? Your medical negligence. Here, medical negligence is absence of reasonable. This word is important. It is absence of reasonable skill and care. So this is what medical negligence definition is. So why am I stressing upon this reasonable word is that we will see now. So here they have given low standard of care, accepted standard, like something like that. They are giving some standard of care. Why is it important is that we have something known as Boehm's test. So what is Boehm's test is that it is a principle upon which we decide whether an act was negligent act or not. Okay, this will decide whether the act is negligent or not, and this is usually used in the court of law. So if you take this scenario, this case to the court, how they will decide whether this is negligent or not? It is based upon this Boehm's test. And what are the components of this Boehm's test? We will see. So first component, you have standard care. So what this standard care means is that, see, you have MBBS graduate, you have DM specialist. Okay, everybody is a doctor, and each and every individual can treat any patient, and they can also be sued for medical negligence. Now, where we will be decide like what is the standard. Okay, that standard, it is something prescribed by a standard medical body. Okay, like your ICMR, WHO, all those standard medical bodies, what they prescribe, that standard treatment is what everyone is supposed to provide. Like you can have a MBBS graduate and you can have a MCH person. Now, will you see the expertise, level of expertise at par with both of them? No, right? Like obviously, the MCH graduate, he would have done a lot of cases and his expertise would be much far better than the MBBS graduate. But that does not mean whatever the MBBS graduate is doing is wrong, as long as he is following the standard care. Okay, that standard acceptable limit of care, if he is following, then it is fine. He does not need to be an expert. Okay, no need to be an expert, but at the same time he have to provide a reasonable standard care to the patient. That is the first thing. You have to provide standard care, not an expertise level of care. That is the first thing. Next, second part of the Boehm's test is that it is very important here. Like there will be usually multiple school of thoughts regarding treatment. Like your ICMR, it will come up with one guideline for treatment, and WHO, it will come up with one guideline of treatment. Like if you take your OG cases like PPH management, like our OG body, they will have one standard guideline of treatment, and WHO will have one standard guideline of treatment. So every single body, they will have their own standard. AIMS will have their guidelines. So there will be multiple guidelines, but if you follow any, at least any one of this guideline, it is fine. You should not be like, I have my own guideline and I will follow that. You should not be like that. You have to follow any standard medical body's guideline, at least one approved guideline of treatment. This has to be followed, either your ICMR or WHO, any standard medical body's treatment guideline, it should be properly covered by you. Okay, this comes important when, like, there will be, for a single disease, there will be different mode of treatments, right? So there will be different regimes. Some will say 6 months, some will say 9 months, like that. But like, let's say you're following 6 months regime and the ICMR guideline is 9 months. Now, if we are following WHO regime and ICMR regime is 9 months for a treatment, and if a patient comes and put a case against you like, see, the WHO guideline is 6 months and ICMR guideline is 9 months. We are in India, we should follow this ICMR guideline, and this doctor, he is not following ICMR guideline. So this is not a standard treatment given to me. So I will sue this doctor for negligence. Like that, he cannot put a case. You can always say that I am following WHO, which is a very good reasonable medical body, and I am following their guideline. So there is no issue with my treatment. I am following the standard operating procedure. Like that, you can always claim. So these two things you have to prove when you are applying for a case of negligence. So now, taking this in mind, if you see here, so the physician acted with a low standard of care compared to other physicians. So what does it imply? This is in reference to the first law, that is, as long as somebody is giving a reasonable accepted standard of care, then there is no issue. They don't need to be an expert in that area. They have to be a like standard care, like what is expected of them, like the minimum level that is expected of them, they have to provide. And if they are not providing even that minimum level of standard treatment, then you can sue them. So here it is like compared to other physicians, no. So this option is not right. Next, the patient must demonstrate that the physician's actions were deliberate. No, it need not to be. See, negligence, when you will say negligence is you have to follow 4 D's. Okay, there are 4 D's of negligence. Those D's are duty, dereliction of duty, damage, direct causation. So these are the 4 D's of negligence. Like when 4 of these happens, we call it as a negligence. That is, the patient and doctor duty was established, that the patient is yours. Patient doctor duty was established. This relationship was established, and there was a dereliction in the duty, that you did something negligent, you did something wrong. That is your dereliction. That was something wrong was done. That is dereliction. And damage, because of that wrongdoing, some damage, something, some loss occurred to the patient. And direct causation, this damage was directly due to this dereliction. Okay, whatever wrongdoing you did directly resulted in the damage to the patient. So only if 4 D's are done, we will call it as a case of negligence. And here there is no mention of intention, whether it was done accidentally, whether it was done intentionally, it does not matter. Whatever wrongdoing was done by you, if there is a damage to the patient, it is called as a negligence. So this deliberation, that does not matter. So this also need not to be proved. And physician failed to provide care that met the accepted standard, leading to harm. So here is what the Boehm's test is applied. So he did not give the standard level of care. So this option is right. So this is the answer. So this is the correct answer for this question. And fourth option also we will see. The patient must have signed a consent form prior to treatment. So when you take a case of negligence, especially criminal negligence, this consent and this contributory negligence, none of these things will play a part. Even there is a consent, even if there is a contributory negligence, if it is a case of criminal negligence, you can't claim it as a defense. So this consent form, it is not valid. So what the correct answer here is, the physician failed to provide care that met the accepted standard, leading to harm. This is the correct answer for this question. And a bit more on the negligence, because negligence this time they have asked, and there is more chance they will ask a lot of questions from this negligence, because this is the most important angle nowadays. Lot of cases are coming up, people are so woke and they are coming up with different types of negligence. So having a knowledge on negligence is very important, not just for exams but also for your practice also. So now we will see about negligence. So we already saw what is the definition of negligence, that is absence of reasonable care. And D's of negligence, we have seen the 4 D's. Now we will see the types of negligence. So broadly, negligence can be divided into medical negligence, that is your civil negligence. Then the most famous, criminal negligence. And after that, you have the patient negligence. So these two, these are doctors. They are responsible. So they were negligent and some damage happened because of that. And here, the patient is negligent and damage happened to the patient because of that. And apart from these three, we have also composite negligence. And corporate negligence. So mainly in civil negligence, what will happen is that there will be mostly like minor damages would be there. There will be minor damages, and the patient, they will fight for like monetary compensation. There will not be loss of life or some grave damage to the patient. There will be like a loss in the quality of the life or a quality of their experience. So something like a minor damages, they will claim under civil negligence. And criminal negligence is your grave damages like loss of life or some like severe morbidity. So these kind of things, it will come under criminal negligence. And this patient negligence, what will happen here is that the patient, he will be negligent and he will say it is not my fault. I am suffering all these because of your fault. So what happened in this patient negligent is that we will take an example. So a case comes to you. It is a case of road traffic accident and you are seeing a open wound. And what will happen here is that, see, there will be two scenarios. So you see a case of open wound, and in first scenario you are saying, see, it is an open wound, I am giving you antibiotic, you are prescribing antibiotics and you are doing the dressing and you are properly closing the wound and you are giving all the advice to the patient, and he goes to home and he follows everything and nothing happens. This is a normal scenario. But in this scenario, what he will do is he will go home and he will open all the dressing and he will apply some cow dung. Because of his superstitions, because of his belief, he will apply cow dung to the wound and that wound will get infected. And now he will suffer some severe damages, maybe like sepsis or loss of limb, something like that. He will suffer some damage. So now he will come to you and he will say, you did not treat me properly and this is your fault. Like that he would say. But now here, was it actually the doctor's fault? No, right? It was the patient's fault. So this is your patient negligence. Right? This is an example of patient negligence. Now, second scenario. Here what happened is that you have prescribed him antibiotic and you have told him that it is an open wound. There is more chance for infection. Don't do anything stupid. Just keep it clean. I am like keeping it open. I am not putting any dressing, but keep it clean. Like that, you are advising the patient. So, you are not putting any dressing. You are leaving the wound open and you are sending him home. But you are giving antibiotic and you are prescribing him about all the things that he should do and should not do. But even then, he goes and do the same thing. Okay, he applies cow dung and the wound is getting infected. Now, here, whether it is the negligence of patient alone? No, right? Here, you should have properly dressed the wound. Even though you have given him antibiotic, you have given him all the advices, the standard procedure is to cover the wound. Since it is a open wound and all, you should have covered it. So, here, you are also wrong and the patient is also wrong. Here, both are wrong. And this kind of negligence is known as what? So, this is your, right, this is your contributory negligence. Contributory negligence. Clear? So, this contributory negligence, you cannot claim it as a defense if it is a case of criminal negligence. Clear? So, this is the most important thing in respect to this contributory negligence. So, contributory negligence, not a defense in criminal negligence. So what will happen is that in this normal case, if it is a case of civil negligence and you are claiming contributory negligence, what will happen? Normally, if it is only the negligence of doctor, you have to pay the full monetary compensation. Now, if you say if it is a patient negligence, you don't have to pay anything. And if it is a contributory negligence, the monetary compensation, it will be like it will be halved, or it will be adjusted with with the degree of the negligence, whether who was more negligent, whether it was the doctor or whether it was the patient. Depending upon that, the negligence will be calculated and the monetary compensation will be done based upon that. So this is another type of negligence. So now we have seen this criminal negligence and civil negligence, patient negligence. Next, composite negligence is, see, nowadays we see multiple doctors, and even the doctors, they will refer us to multiple specialists. Now, what will happen is that sometimes these composite negligence happens. That is, the multiple doctors that we are seeing, all the doctors, all of them are negligent. That is, two or more doctors, if they are negligent, if all are negligent, we call it as composite negligence. And whatever the punishment or whatever the fine, it will be equally shared among those doctors, like whoever saw the patient. And like if all of them are negligent, all of them will share the punishment, and all of them will share the fine, and they will give it to the patient. So this is your composite. Two or more doctor is negligent. And finally, your corporate negligence. Here what will happen is that is not the fault of doctor. We will take an example for corporate negligence. See here, this is your famous example. So what will happen here is that there will be some faulty management. See, there will not be proper O2 cylinder. See, there will not be proper instruments will not be properly managed, like something like that. Fault from the management side. There will not be proper beds, and because of the patient got injured, proper instruments are not kept because of the patient got injured. So it is not a negligence from the side of the doctor. There is no reasonable absence of care or skill from the doctor. There will be reasonable absence of skill or care from the hospital side, from the corporate side. So that we will call it as a corporate negligence. Here the doctor is not negligent, and he is also not responsible. Here the solely the hospital, that corporate, that owner is responsible for all the negligence, and whatever the punishment fine is coming, he have to do that. So he is not responsible. Doctor is not responsible in this corporate negligence. So these are the important types of negligence that we need to know. And a bit more on this criminal and civil negligence. Why? Because it is very, very important. So the main thing we need to know in criminal civil is that, so first in criminal, it will be a fight between state and doctor. Okay, so the state, they will take up the case of the patient and they will fight against the doctor. In case of civil negligence, it will simply be between the patient and doctor. So it is patient versus doctor. Here it is state versus doctor. And the main thing here is that the damage, based upon the damage only, we will divide them into criminal and civil. Criminal, it is a very, very grave damage. Loss of life, loss of limb, something like very, very grave major damage. But in case of civil negligence, it's something very, very minor, that he had to be hospitalized for 2 more days, or he had to miss his work for some 2 days, like something very, very minor. And always the punishment would be, here it is always a monetary compensation. Monetary compensation is always done. But here it will be imprisonment, and there will also be fine, possibility of fine. So this is very important here. And one more thing I already told you, this is very important, like this consent and contributory negligence, they cannot be claimed as a negligence, not as a defense. So this consent and contributory negligence, they are not claimed as a defense in case of criminal negligence, but here it can be claimed. So these are the main things that you need to remember in criminal and civil negligence, that it is fought between state and doctor, and here it is only patient and doctor, and since it is a criminal, it will be done in the criminal court. Here it will be civil court, like your consumer forum, something like that. So these are the main differences between civil and criminal negligence. Now we are done with the important types and the most important points related to the negligence. Now next thing we have to know is few concepts in case of negligence. So these concepts, they have been asked previously and they are very repeatedly asked initially. So first, vicarious liability. So what is vicarious liability? Like this simply means not only for own action, not only for your action, but also for your like servant's action. Okay, servants means like let the master answer in that context. Okay, like whoever is working beneath you, like working along with you for all their action, you are responsible. Like whoever is working under your supervision, under your direct supervision, you are responsible for all their negligent action. Clear? So the example is what? We all know this example. So surgery, and a nurse, she leaves some swab or something inside the abdomen, but it was your duty. You should have thoroughly checked whether anything is left or not. It is your responsibility. She was merely acting under your supervision. So whatever negligent action she commits, you're responsible. This is your vicarious liability. Clear? So surgery, swab left by nurse. Doctor is responsible. This is your vicarious liability. Because that nurse, she was acting under your supervision, your control. So you're responsible. Another example could be HOD and an intern. So that intern is operating under the supervision of the HOD, and that intern did some mistake and HOD is responsible. This is how it works. This is your vicarious liability. It also means let the master answer. So this is very important. Next, borrowed servant doctrine. So this is also an extension of the previous thing. So who are working under your direct supervision, any negligent act committed by them, you are responsible. But let's take this case. Here this nurse, she is not your regular. She just come for that single case. So what will you do? You will say, no, she is not my employee. I am not responsible. So that responsibility is fully upon that nurse. Like that you cannot say, because even that nurse came for the single case. At that surgery, she was under your supervision. So only you are responsible. So this is your borrowed servant doctrine. Like not only your regular employee. Okay, not only your regular employee. All those working under your supervision. See, finally, you're the one who is supervising them. So whatever negligence happened, it is happened only because you were negligent. See, so this is like borrowed servant, like doesn't matter. Even if they are temporary or your regular staff, it does not matter. Like their negligent action, you are responsible. So this is your borrowed servant doctrine. Clear? Next, res ipsa locator. This is thing or fact speaks for itself. So this is the thing. So you are doing surgery, you or your nurse, somebody left swab inside, and later on the patient, they develop some sepsis, some damage, and they die. So now when the case comes to the court, there is no need for expert evidence. Why? Because even a layman, they can say that swab, it should not have been there. So that swab is there, it is showcasing your negligence. So here, that thing or that fact, it is speaking of your negligence. This is res ipsa loquitur. Clear? So the main thing that you have to cover here is that there is no need for expert evidence, because that negligence is so apparent. Okay, so negligence is so apparent, so clear, and that negligent, like whatever negligent that happened under your direct supervision, and that damage causing instrument or whatever that act, it was done under, like directly done by you. Okay, you are solely responsible. Whatever that action caused the damage, that action was solely done by you. That thing has to be covered in this res ipsa loquitur. The main thing here is that there is no need for expert evidence, and the negligence would be so apparent that you need not prove anything beyond that. So this is your res ipsa loquitur. And this common doctrine of common knowledge, it is the same thing. Okay, here also the same thing. Here also the negligence will be so clear, and this is like used in synonymous with each other. The both things are meaning the same thing. There will be very, very apparent negligent act, and there is no need for expert evidence. And these are the important concepts, and now we are moving to the defenses that we can claim against negligence. So first is your medical misadventure or maloccurrence. So this concept is something very, very important for us, because like medicine, it is something really very unique thing. Okay, each and every individual, they will react differently to all sort of stimuli. Like each and every diseases, they will have different type of manifestation. Each and every medicine, they can have different types of effects on the individual. So these context, they will be covered under this misadventure or maloccurrence thing. We'll take an example. Okay, so here you are an intern or you are a practicing doctor, like you're a doctor, and you have a case. Okay, somebody is coming with some infection, and like you see that they need some antibiotic administration, and you choose to give the penicillin. So first, if you are giving penicillin, you should know why you are giving penicillin and what are the like precaution that needs to be done before giving penicillin. Everything should be known to you, because that is what expected of you. That is the bare minimum that is expected of you, right? So now before giving penicillin, what you have to do? You have to do sensitivity, drug sensitivity test you have to do. So you are doing sensitivity test, and like nothing comes up. Okay, so there is nothing significant. So you're going ahead and you're giving the bolus. Okay, you're giving them the dose. But suddenly what happens is that, so you're giving the drug, but suddenly the patient, unfortunately, they develop anaphylaxis. Clear? So now what will happen? The patient will come and say, you gave me some poison, you gave me some wrong drug, some wrong treatment. So something happened to me, I incurred some damages. So I am suing you for negligence. Like that, the patient will come and say. Now, what will happen is that when you go to the court, you can always say, see, I followed the standard operating procedure. I followed the prescribed thing. Okay, whatever that needed to be done, whatever the precaution that needed to be taken, I did exactly that. Okay, I did the sensitivity test, I gave the right medication, I gave the right amount of dosing, I gave everything properly, but even after all these things, this adverse effect happened. Now, in that scenario, if you have done everything with standard care and skill, okay, if you have done everything with standard skill and care, you can always claim this medical malappearance as a defense. Now, nobody can say that you are negligent. All we can say is that it was a misfortune. It was something unfortunate. It was a malappearance, something rare. Okay, so malappearance, misadventure is a something rare happening. Okay, mostly a misfortune. That is your medical misadventure or malappearance, provided you have done everything. Okay, you have given the reasonable care, skill, proper treatment, proper protocol, everything. If you have properly followed, then you can always claim this as a defense. So this is your first defense. So next defense, this is something as new as the name. So novus actus interveniens. Here what will happen is that we will take an example. See, you have a patient with fever and you are administering him, and like as an IP, you are admission, you have done the admission and you are giving him treatment, and you are giving him some steroid treatment. Okay, you are giving him steroid for fever, you are giving steroid, and all of a sudden what happens is that COVID outbreak comes. Okay, COVID outbreak in your hospital, and that patient, he dies because of COVID. Patient dies due to COVID. See, here, this case of fever, it was some infectious cause, and steroid is not the accepted thing to do, right? So, here, you were negligent and the patient died. Okay, so if you look at the thing, there was a duty, there was dereliction of duty, there was damage, that is the patient had died. But here, one D we haven't covered, which is direct causation, right? So, now here you can say the patient, he died because of COVID only. That is true. See, the patient died due to COVID. So, if someone comes up with negligence suit, then there is always a defense that it was the COVID that killed the patient, not my treatment, not my negligence. Like that, you can claim defense. So, this is your novus actus interveniens. That is a new act intervening and breaking the chain of event, right? So this is novus actus interveniens. So you can have another example also in this. See, this example, it is kind of adverse. So there is one case of assault. Okay, there is a case of assault, stab abdomen. Okay, and he comes to your hospital for treatment, and you are negligent and you did some dereliction of duty, and the patient died eventually. Okay, the patient died. Now what will happen is that the one who assaulted that patient, he would say, see, I stabbed the guy, but he died because of this negligence. Okay, only because of negligence he died, not because of my stab. Like that he would claim. So in the court he would say, I am only partly responsible. The doctor is the main responsible guy. He is the main criminal for the death of the patient. Like that he would claim. So this is also a novus actus interveniens. That is a new act. It will break the chain of events. Normally what should have happened? This stab because of the stab abdomen he should have died, but here because of your negligence you did some like like normal abdomen operation, like you left some swab or you left some instruments or you cut the wrong artery, cut the wrong vessel, something like that. You did some negligent act and he died because of that. So this is also an example of novus actus interveniens. So simply what should have happened would be interrupted by a new act, and now the new act will result in the death. So this is your novus actus interveniens, and in the first scenario you will claim it as a defense, so we are seeing it here. Clear? Now third, res judicata. What happens here is that normally like in case of civil negligence, what will happen, like you will go to consumer forum, you have the district level, state level, national level, all the forums you have. So you will start with the district level, like depending upon your compensatory amount you will start at the level. So let's say here you're starting at the district level, and here you're not getting a favorable outcome, the patient is not getting a favorable outcome. Now he will go above, he will go to state. Even in state, if he is not getting a favorable outcome, he will go to the national level. So like that, from a lower court they will go to the higher court. Okay, so lower to higher they usually go, and once the highest level of court they give a judgment, what will happen is that the judgment is final. So in case of criminal court, if Supreme Court gives something, that is final, right? So you have a final judgment. Now, after getting the final judgment, you cannot come back to the district level and put the same case. Like, I didn't get a proper judgment there, so I want to start the case again in the district forum. Like that, you cannot say. So, once it is decided, once a case is decided in a court, higher court, you cannot bring up it again in the lower level. Okay, you cannot bring it up again in another court, again in another court. So this is your res judicata. Clear? If it is already decided in the court, you cannot bring it up again in the another court. That is res judicata. Next is res indicata. So here what happens is that if a negligence happens, okay, so negligence happened and you are following the case and you are filing a case, and the time interval it should be within 2 years. Okay, beyond 2 years you cannot file a case of negligence. That is this res indicata. Within 2 years you have to file a case of negligence. This is res indicata. Now contributory negligence we already saw. So contributory negligence, here the patient and doctor both are negligent, and depending upon the like who is more negligent, they will decide the fine. This is your contributory negligence. And doctrine of calculated risk, this is very important in case of surgeries. So this doctrine of calculated risk, what will happen? So example, you have a thyroid surgery, okay, or you have like any cases, like you are giving ASV for snake bite. See here, we know that if we do thyroid surgery, there is a possibility that we can cause injury to the nerve and the voice would be affected. If we give ASV to a snake bite case, there is a possibility for anaphylaxis and something adverse could happen. So all the possibilities are there, but still we decide to move ahead. Why? Because here the treatment for thyroid cancer is more important than voice. The treatment for snake bite is more important than the possibility of getting anaphylaxis. So here we are taking a calculated risk. So here we will say everything, we will properly inform all the risk to the patient, and we will get consent, and we will do the surgery. We will undertake the risk. Under such circumstances, even if something adverse happens, even some damages happen, the patient is, he cannot say the doctor was negligent. He cannot claim for negligence against the doctor. That is the thing. So, it is not negligence. Provided the same thing, you do everything properly, you do everything with reasonable skill and care. So, that is a very important thing, care. So, as long as you do everything with reasonable skill, with reasonable care, you are under no threat. You have to be very, very properly careful and skillful to do anything. As long as you do that, there is no need to worry. Nobody will tell something like you are negligent, and they cannot put up a case against you in the court. So this is doctrine of calculated risk. And next defense that you can claim is no duty owed. So you can always say that the patient is not my patient, so I cannot be responsible for the damage that happened to him. So this is something very obvious. Why I am mentioning here is that, see, sometimes the patient will come to you in emergency. Clear? So they will come to you in emergency, and like whether they have something to pay you or not, or you have some difference with them, it does not matter. As long as the patient is in emergency, you have to treat them. Okay, you cannot deny. No denying of treatment. You have to do at least first aid, you have to do resuscitation, and you have to refer them. So in emergency, never deny treatment, and if you deny treatment, you will be coming under a criminal case. So this is another defense. And next, patient negligence, obviously you can claim it as a defense. And voluntary non-fit injuria, this means voluntarily putting oneself in path of danger. See, this is voluntary non-fit injuria. That is, see, we'll take an example. See, radiotherapy. So, for a cancer treatment, a patient is undergoing radiotherapy. And radiotherapy, all the adverse effect you would have told them initially. So, that is the standard practice, right? So, we will tell them all the adverse effect of radiotherapy. So, like the patient, he is starting the therapy, and soon he is getting some burns because of the radiation. Now, he cannot come and say, see, I got burns because of your negligence. Like that, he cannot say. Why? Because he voluntarily agreed for all the adverse effects of the radiotherapy, because radiotherapy is important and he is undergoing radiotherapy. So in this case, it is almost like your calculated risk doctrine. So he voluntarily came and he voluntarily did everything. So there is no point in putting negligent case against the doctor. So this is also a defense. And this, finally, this one, product liability, this is very important. Here what happens is that you will have faulty instrument. See, you will have a faulty instrument. There will be no negligence from your side, no negligence from the doctor's side. No one is negligence. It is actually the component, that the physical thing that you are using, whether it is a diagnostic instrument or it could be a medicine. So whatever thing that you are using, that thing is faulty. That product is faulty. So this is your product liability. And if you prove that it is the product's fault, then it will be the manufacturer's responsibility. Okay, it is the manufacturer's negligence. No one will be held negligence except for the manufacturer of that product, not the corporate or not the patient, not the doctor. It will be the manufacturer of that product who will be held negligence. This is your product liability. Next, defensive medicine. So defensive medicine is when you prescribe all sort of tests, okay, all sort of and all sort of medications, everything, just to escape the negligence suit. When you overdo it, this is something known as defensive medicine. And medical indemnity insurance, it is more like insurance policy. So you will pay premium to insurance companies, and in the future, if you get into any negligence suit, they will come and cover for you, and they will pay you all the expenses. So this is your medical indemnity insurance. These are just few terms that you need to know. So these are the important things that you have to know in case of negligence. Now we are done with negligence. We are going to the next question. Which of the following statement best describes the principle of professional confidentiality in forensic medicine? So this is something, another important thing in forensic medical ethic. Okay, so this confidentiality, patient doctor relationship, this is also important. There will be medical scenario given in this also. So first, forensic expert can disclose patient information if it is in public interest. Confidentiality can be breached without consent if it is a court order. And confidential information can be shared freely among professionals regardless of necessity. And a forensic practitioner is not obliged to maintain confidentiality in case involving minors. So here it is all about patient-doctor relationship. So the answer here is confidentiality can be breached without consent if there is a court order, and we will see why. So first, the forensic expert can disclose patient information if it is in public interest. No, actually. So the forensic expert, like whatever the case that comes to them, like mostly the autopsy cases, like everything should be kept under confidentiality. If the, like unless the court asks you to tell the information to the public, you should not tell anything. Okay, whatever comes to you, it is strictly confidential. And this thing is correct, because if court order is that, you can always say about the condition of the patient even if he does not give consent. And this third point, see, when we share the history or the medication about the patient to the fellow colleague or somebody, or if you are sharing it to some journal as a case presentation or something, see, you should never breach the confidentiality. Like you have to get proper consent, and even after getting the consent, you have to properly preserve the privacy of that patient. So unless it is completely necessary, even in such cases, you can give some very needy information only, only the necessary information, not every information, only the necessary information we can share. Not all information we can freely share even with the colleague. And in case of minors, what happens is that you can share it to the parents. Okay, you should. Okay, you will share it to the parents, but to others you should not do it. Okay, only to the parents you can say, not to everyone else. So this answer is the correct option. And we will see about professional secrecy. So professional secrecy, like I said, it is the patient doctor confidentiality. And see, legally the doctor is bound to preserve the privacy of the patient. It is very important. And this professional secrecy, it does not matter who is paying you. Okay, let's see one example. If a master, okay, master is paying fee for the servant, paying fee for servant. See, in this scenario, will you disclose the diagnosis of that servant to the master? No, you should not. Because even if the master is the one who is paying you the fee, it is the privacy of that servant, your patient, it is important. Okay, that agreement, it is between you and your patient, not the one who is paying you the fee. So you should not disclose the diagnosis of that servant to the master. Clear? This is your professional secrecy and you should always maintain it. But there are certain exceptions where you can break that confidentiality. We call it as privileged communication. Okay, here you will break the confidentiality. So why we would do that? It is for someone's welfare. So it is for the welfare of the patient. So you are having a male, okay, you are having a male and he is testing positive, okay, for HIV, and now you have to inform it to the wife of that male. Okay, see that husbands, you have to inform it to the wife. So that is for the welfare of the patient and the individual. You have to disclose the information here. Even though you are breaking the confidentiality, you are doing it for the welfare of the patient and his wife. So you have to do it. So this is exception and it will come under privileged communication. Next, it is for your welfare of self. In case of negligence, okay, in case of negligence, you can divulge the information about the patient in the court. That is allowed because you are doing it to defend yourself. So that is also allowed. And others is like if you are giving in the court, okay, if the court orders it, you have to give. There is no confidentiality under such circumstances. If the court asks for some information, you have to provide it. And if it is like some notifiable disease, okay, like COVID came and whoever were diagnosed with COVID, we have to tell it to whole city, everybody we have to inform, right? So these notifiable diseases, you have to inform. And in some cases, like this case, see this master and servant, in this case, if this servant, if he is a cook and if he is diagnosed with typhoid, in such circumstances, you have to inform the master because he is a cook and it is possible that he will spread the typhoid to the whole family. So that circumstances also you have to inform. Like if you see a colorblind person driving a vehicle, if if somebody with some communicable diseases, if they are coming in contact with somebody, so like all those things you can inform. These will come under privileged communication. Clear? So generally you have to maintain a secrecy, and the exception to this secrecy, we call it as privileged communication. We mainly do it for the welfare of somebody, whether the patient or somebody associated with the patient, or for the welfare of the society, or for the welfare of the doctor. We do it. We call it as privileged communication. Next, we have therapeutic privilege. So what happens here is that, like the confidentiality clause, we have one more clause between doctor and the patient. So whatever the doctor is prescribing, okay, the doctor and patient, there will be transparency. Okay, so whatever the diagnosis, whatever the medications, everything that is being done by the doctor, it should be thoroughly explained to the patient. This is your normal now. Clear? This is how it should be done. But some circumstances, okay, under some circumstances, the doctor will not inform the patient about certain things, okay. Doctor not inform the patient about diagnosis and treatment. So this is therapeutic privilege. Why? This will be done to prevent the patient, for the welfare of the patient. Clear? Example is, if a patient is diagnosed with some grave disease and if he is already under suicidal thoughts, you will not inform the patient about that grave disease. You will obviously call his attendant, you will call his legal guardian. Like if a husband is coming, you will call upon the wife and you will tell them about the diagnosis. Okay, you will not directly tell the patient because he is already having suicidal thought and it will further only harm him. So under such circumstances, you can withhold some information. Okay, so this is therapeutic privilege, but generally it should not be done, but under certain circumstances you will do it. That is your therapeutic privilege. Clear? So with this question we will end this and we will meet after a short break. Thank you.